My name is Nicole Otto. I'm in 4th semester. Today is April 16th and it's about 8:15 in the morning, and today I'm going to insert an NG tube. Before I begin, I want to make sure I have a physician's order and look at my client's history to see if he has had any recent nasal surgeries. So let's get started. Hi Mr. Bob, how are you? My name's Nicole. I'm going to be a student nurse today. Can you verify your name and date of birth? Great. Do you have any allergies? No. Good. Today we're going to insert an NG tube, okay? I would close the curtain to provide for privacy on my way in. I'm going to put my bed to a good working height and assist my patient into the high Fowler's position. And I'm going to assess my patient. I already looked to see if he had any recent nasal surgeries. Going to look in his nose, see if he has any abnormalities or symptoms. Assess his ability to breathe out of each nostril. I'm going to assess his gag reflex and his mental status to see if he's going to cooperate with us today, which he is. So let's get a few things set up. Towel on my patient's chest. Going to get my pH strips ready. Going to tear off 4 pieces of tape, and I would make sure my table is clean before I would place them there. And I have one long piece that I'm going to tear down the center. I'm going to open my tube and get my tubing out. And I'm going to measure how far to insert the tube. So from the nose to the ear, and then the ear down to the xiphoid process, which is right at 55 centimeters. So I'm going to mark that with my tape at 55 centimeters so I know how far to insert it. And I'm going to wrap this around my finger about 10 to 15 centimeters to make it a little easier going into my patient's nose. And I'm going to lubricate it about 4 inches. I'm going to make sure my patient is able to swallow because I'm going to have him take some drinks after we pass the oropharynx. And I'm going to set up a communication so if my patient needs a break or needs me to stop, just have him raise his hand. Alright, Mr. Ball, I want to have you take some deep breaths. I'm going to insert it, okay? 1, 2, 3. I'm going to be inserting it, having him take deep breaths. He's going to be coughing. And I'm going to have his head tilted back when I insert it. And once I pass the nasopharynx, I'm going to put his head down, have him take some sips, and I'm going to advance it 2 to 4 inches with each sip. And if I meet resistance, I would withdraw it, lubricate it, and try the other nostril. And you would insert it until your tape, which is at 55, but because the mannequin doesn't allow this, I'm going to stop right here. I'm also rotating it 180 degrees as I go in. Going to temporarily secure this to my patient's face so I can check the placement. First, I'm going to aspirate pH content. And put it in here. Going to check my pH. And it is below 5, so that is good. Now I'm going to push air in to check placement. I'm going to listen over the xiphoid process. I should hear a whooshing sound, which I do, so I know I'm in the right place. And then if you're unsure, a x-ray is always the best and to know if you're in the right place. So I'm going to do this. Do some hand hygiene. And I'm also going to check and make sure the tube is not in the back of the mouth before I check placement. And I'm going to tape this to the bridge of his nose. If his nose was oily or anything, I would wipe it off beforehand. Putting it on the bridge of the nose and then wrapping it around. I'm going to remove it from his face. And attach it to his gown. And then you could hook this up to a tube feeding or suction. This would be attached to his gown, and then I would hook it up to tube feeding or suction, or in this case I'm just going to clamp it. I'm going to take this off, throw this away in my dirty linens. I would clean up my table, and then I'm going to see if he wants to wipe his nose and clean up a little bit, and then I am going to document everything I did. I'm going to say that I inserted it, what tube I inserted, what I got when I aspirated, and the date and the time.